Hi everyone, I'm Ashley Frame and I chose to do my presentation on blood doping. Perhaps the most recognizable case of blood doping was when Lance Armstrong admitted to doping to further his cycling career. But what exactly is blood doping? How would it benefit athletes? And why is it so bad for your body? So what is blood doping anyway? I found that there were three main types: blood transfusions, erythropoietin injections, and synthetic oxygen carrier injections. Blood transfusions can be either autologous or homologous. Autologous would be when a person draws a pint of their own blood and injects it later after their body has replenished the erythrocytes that were lost. This would significantly increase the blood volume, allowing more oxygen to be carried to the muscles, resulting in prolonged time before muscle fatigue. Homologous is the same process of injecting an extra pint of blood, and the results would also be the same. They would just be from using someone else's blood that has the same blood type. Erythropoietin, or EPO, is a hormone produced naturally by the kidneys that is responsible for stimulating red blood cell production within the bone marrow. If a person injects EPO into their blood, they would create more erythrocytes carrying oxygen to again increase stamina and aerobic capacity. Two main types of synthetic oxygen carriers are hemoglobin-based oxygen carriers, or HBOCs, and perfluorocarbons, or PFCs. They are normally used in place of blood transfusions. If human blood isn't available, there isn't time to find an appropriate blood type match, or the patient has a high risk of infection. These chemicals have the capacity to carry oxygen as well, which again would allow the muscles to sustain longer strain. When you inject anything into your body, there are several health risks. There are also some serious risks that come with increasing a person's red blood cell count. Thickening the blood causes an increased risk of stroke, heart attack, heart disease, and embolisms or clots. Possible side effects of blood transfusions include fever, rash, and allergic reaction, not to mention any number of infectious diseases present in the blood being transfused. Side effects of EPO injections include increased potassium levels, high blood pressure, flu-like symptoms, and the development of autoimmune diseases. Again, with injections of any kind, needle contamination is also a concern. Although these techniques may sound like a great asset for athletes, they are all currently banned from use by the World Anti-Doping Agency, who perform regular tests on athletes for blood doping. For those athletes looking for a legal training plan that has the same results as blood doping and is accepted by the World Anti-Doping Agency, I did find an option. The use of hypoxic tents before training have the same effects on the body as blood doping. These tents have low oxygen concentrations, which increase a person's EPO. That will stimulate the production of erythrocytes, increasing oxygen carrying capacity. The same health risks resulting from increased blood volume, such as heart disease or blood clots, are still a concern even with this legal method.